time once again for Community Forum, and we are very lucky to have with us back live in the studios, Shilo Murphy. Shilo Murphy is National President at the Urban Survivors Union and co-founder and executive director at the People's Harm Reduction Alliance. Shilo, thank you very much for coming in and spending time with us again this morning.
Yeah, thank you for inviting me.
So for those that are not familiar, can you start out and tell us what the People's Harm Reduction Alliance is?
People's Harm Reduction Alliance is really where love meets the streets. It's a nonprofit that started in 2007 when King County Public Health had cut in funding to the University District Needle Exchange. And then we organized with a handful of volunteers and former staff. And we started myself, Tom Fitzpatrick, Jeff Corey, and we had 3 months supply for the University District Needle Exchange, whether or not we were going to exist. And no one thought we would succeed. And now we're the largest needle exchange in the country. 7 years. We kind of changed how needle exchanges were perceived, and we put the people we serve in charge of making decisions. We put them on the board of directors. We put them on staff, and we let them come up with our strategies. And it became this really beautiful peer-run system that really empowered a generation of drug users into taking part of their lives, taking part of their health, becoming more active in the war against drugs, and the sense of being active against the war against drugs. And so it was really excited. The U-District Needle Exchange also was started by Bob Quinn in 1990, making this our 25th year, making us one of the oldest needle exchanges in the country. And I think for me, it's a little impressive when you think of 1990, a needle exchange gets started in the University District. We're in the middle of the AIDS crisis. People are dying. People that we are giving syringes to we're not seeing again because they've died. And how far we've come from that place where it's big news when one of our participants dies. And not to say that it wasn't big news then. There were just so many of them who were dying. The folks who worked there in those early days talked about some severe emotional damage of constantly seeing people that they know and love pass away. I've been in the organization for 18 years, started in 96. So it's been a lot of fun.
And what is the Urban Survivors Union?
So the Urban Survivors Union was started I co-founded it with Courtney Chaos, who we were tired of drug policy work being done by non-drug users. And they were starting to try to attempt to pass laws and fight stigma in a way that didn't really affect drug users. And we felt that nothing was going to change unless drug users took control of their own lives and took control of their own lobbying. And we founded the organization, the U District. It now has chapters in San Francisco and Greensboro, North Carolina. And it is really a place where active drug users can come and organize to better their lives and to do things like Naloxone organizing, doing things like lobbying for organizations for to give out meth pipes, doing things like trying to engage politicians in changing the laws that discriminate against drug users. So it's really, in that sense, a really exciting, empowering place. And we're not the only drug user unions out there. There's Vocal New York. There's there's New England Drug User Union. There's User United. So.
All right, and back to the People's Harm Reduction Alliance. What are the services and products you?
So the services we can get. So if you go to the University District Needle Exchange, you can get 300 syringes. But we also are so first, let me go through the supplies, I guess. So we can get a cooker, a cotton, a paper clip, an alcohol wipe. Those are all things that you need to use to inject safely. And if any one of those have hepatitis C, you could end up injecting hepatitis C. And hepatitis C is the number one thing that affects folks. And if you think you're at risk for infection of hepatitis C, we do testing on Fridays, 1 to 5. So other things you get, one of the things the participants talked about was they needed wound care kits because when we used to go to heart review, they were told, how worthless they are. They were lectured. They were told that they deserve this pain that they got. They told that they weren't going to get pain meds, even if they had to cut open their abscess. They were really getting underdeveloped nation status of health care. And so these are just some basic things that people ask for. Thankfully, the conditions have changed in the sense that lots of our folks have insurance and can engage their own primary care doctors for their own health. We started handing out Naloxone, which is an opiate antagonist that stops overdoses. When we started having more and more folks who are dying of overdose, it really brought tears to my eyes, knowing that a generation of drug users didn't have to have most of their friends die of overdoses. We had, talking about being pure run, we had folks who really complained that in 5 years ago that we were just serving injectors and we weren't serving all drug users. And didn't people who smoke cocaine have rights to and have the ability to get services? And we looked into it, and they were true. That was a community that was completely abandoned. And we engaged them by giving safer crack kits. And a lot of those folks get hepatitis C testing now, and we refer to treatment and detox. We refer to other services, and we became one of the first places that really treated them with respect and brought them in. I remember doing 5 years ago a PowerPoint presentation to a room full of cocaine smokers that was really, I treated them as if they were a funder. And it was really amazing to see how many folks of those who became empowered, became activists, and became a part of their community in a positive way from that, just because we treated them with such respect. And so that was really empowering. And we started having people modernly who said, the reason they're injecting methamphetamines is because they don't have access to a pipe. And smoking is a little safer than injecting. So I really started thinking about this, and we started having conversations with our staff and our participants, and they said, this is really dumb that we don't give out pipes. It's really dumb that all needle exchanges don't give out pipes. And so we became one of the first needle exchanges in the country to start handing out meth pipes. And, I think the thing I love about our organization is we can see a problem and we can have a conversation with people who are in that community on how to solve that problem, and they can come up with their own ideas in solving it, and then we can help implement it. I think it's really empowering. If you are working with African Americans, you have to have African Americans on your board, on your decision-making panels, on your staff. And I see a lot of groups working with drug users who don't have any drug users on their staff or only have people in recovery. And I feel like you're really missing an opportunity for the best and the brightest in your community.
So the meth pipe program just began 1 or 2 months ago.
It did. And it's been wildly successful. There's been a lot of folks who are coming from different parts of the city to get them. There's a lot of folks who are engaging us that had never engaged us before. And there's also a lot of folks who are coming to get syringes, who didn't, who were meth users, who didn't realize there was a program that existed.
So I think a lot of people would find that fairly shocking that there's an organization locally that hands out free meth pipes, crack pipes, and syringes to people. And to quote an excellent article about you and the work your organizations are doing that ran in The Stranger recently by Brendan Kiley. Was that who
Yes.
wrote that? One of the comments in there that I think some people would relate to was he thinks he's doing good, but in reality he's enabling a tragic and deadly addiction. Shame. So what would be your response to that?
Well, I would say that it's not tragic because we're engaging drug users on where they're at, and we're doing harm reduction. So if you tell someone that drugs are bad and you shouldn't use them, and just telling them to stop, all the people who would listen to that have already stopped. So what do you do with everyone else? Because doing nothing help cause HIV infections, hepatitis C infections, wound care, people dying of overdose. That's when doing nothing did. It caused people in our community to lose a life and to suffer. And for every life that's lost in our community is a loss in potential and a loss in creativity. I can tell you that as someone who's had 7 overdoses, if I died in any one of those overdoses, you would not see the person here I am today. And you can not agree with me. You can say that the work I'm doing isn't the best, but I think you can't say that I'm not a positive influence within the community and in the discussions. So by doing nothing, it's actually a huge detriment to the society. And to be also honest, we're the number 1 referral to treatment and detox. We are the place where people go to get access to recovery services. And so without us, that's another avenue that people do not have for recovery. And the message that we have is we want you to be the best drug user you can be. We also want you to be the best at sobriety you can be. But I think condemning people and telling people they're bad people because they've relapsed and talking about this purity that doesn't really get achieved in a lot of circumstances is detriment to the person. But to tell them that they are loved, that they are worth it, that we are proud of them just the way they are, is a truly empowering thing. I believe that is the most important thing we do, is we engage the human being on their own terms, and we build their confidence and build who they are up, because they're told by the world around them through stigma and bigotry towards drug users that they're worthless. And that is doing more damage to that person. And so we tell them how proud that we are of them. And we say, hey, if there's something in their lives that doesn't make them feel like they're fulfilling their full potential, then let's talk about how do we change that. Let's talk about what's best for them. And they're the deciders of that because it's their life. And that is the thing that I think is the most important message, is harm reduction meets you exactly where you're at, and you become the own judge of your own life. So that is where I think we're not really doing damage to the community. We're actually building community up. And, if drugs are a negative force in your life, then you're going to be able to see that in whether or not, it's affecting your life, whether or not it's affecting your work, whether or not it's affecting your relationships. And you will have the ability to start making choices to help change that. And we will help you and support you with that.
So that support and the connections to the different programs in the greater Seattle-King County area is one of the services you provide at your facility, which is located
so
where?
We are located in 5 counties in 2 states. We're located in Ellensburg, we're located in Olympia, we're located in Bremerton, Seattle, and Portland. And if you go to our website, which is, I know, one of the longest websites possible, thepeoplesharmreductionalliance.org, then you can go to just our schedule, and it'll have all the schedule of all the days it operates. And we do things from Iggy Hop in Olympia that's on bicycles, delivering services for homeless folks and delivering needles, on a bike with a cart, all the way from a car delivery to the North and East King County to physical sites like in the University District.
So talk a bit more about one of the things you supply people is naloxone.
Yeah,
Narcan?
naloxone is an opiate antagonist that stops overdoses, and it's something that takes 2 minutes to be trained on. If you have someone in your life who's an opiate user, regardless if they're using street drugs, I encourage you to come by to one of our sites and pick it up. if you basically the quick thing about it is it's an opiate antagonist that basically if you think of your opiate receptors in your brain as a keyhole and you think of opiates as the key, naloxone comes and covers the keyhole to make sure the opiates can't get to the receptors. It lasts somewhere between 60 and 90 minutes and is lost my train of thought. So it lasts 60 to 90 minutes and can save your friend's life. And I encourage everyone to get it.
And again, it's something that you give out free.
It's totally free. You can come to any of our sites to get. We pay the cost. If you want to help support our program, you can always do a big, giant, fat donation at our program, or you could come to our Stand Up for Harm Reduction on May 13th at Jet City, and you can buy tickets on our website. Shameless promotion right there.
It's all right. So the naloxone, for people that, let's say, want it potentially for friends or acquaintances, something they want to keep on hand, is it something that is injected? Or?
So ours are an injectable kind for two reasons. One, it's the most effective. Two, we work primarily with injection drug users who don't have aversions to needles. And honestly, the third one is it's a lot cheaper than the nasal kind. So all those factors make it so we end up having injectable Narcan. And there are hundreds of lives saved with the Narcan we give out. And I think it's really empowering that active drug users are saving their friends, their lovers, their companions with Narcan. They're the ones who are being trained on using it. And it can be incredibly empowering to be like, I saved a life. I am a hero. I'm not just a heroin addict or a heroin user. I'm the person who saved my friend's life. And it can be life-changing for folks.
And isn't the pharmaceutical industry now raising the prices significantly on that drug?
They are. It doesn't affect us quite yet, but they are raising the prices on it. It's realistically a monopoly right now, with only one company selling Narcan, although there is talk that another company might bring it to the market. It's entirely a generic drug, but right now there's only one manufacturer of it, isPHRA. And they're essentially randomly raising the price because the chemicals making it haven't changed in price.
All right.
Yay, capitalism.
So it would seem that some of the activities that your organization does are not currently legal. They're so cutting edge. What's your relationship then with law enforcement as to the different services you provide?
Law enforcement has been incredibly supportive of the service we do. I think a captain of the Seattle Police Department said this and said, to be perfectly honest, because of the drug war, I will be having to put hands on a lot of your participants in arresting them or searching them. And I personally would like them to be as disease-free as possible when I do that. And so I want to support the work you do, and I want to make sure that you can do the work you do. Police don't really come around the needle exchange when it's open. I mean, occasionally they'll drive down the alley of the U District site or go to a different site, but that's usually unrelated to us. And I've talked to many police officers who've been incredibly supportive of the work we do, and have honestly asked how the police department could help support it. So we're lucky in Washington and the vast majority of police departments who do support it. I do think there is a difference in our state than Seattle to the rest of the state. But I find that people in some of the more rural areas that we serve are also just as supportive of the needle exchange.
And what's your relationship with the Seattle-King County Health Services?
Health Department? The King County Health Department gives us about 40% of our supplies for the U District and King County. They have been big supporters of ours. Unfortunately, they had to cut services to street outreach services who used to run us. But then a couple months later, they started giving us in-kind supplies to support our program. We have a really great working relationship. I would say our relationship is better than it's ever been in our entire history. And they are one of the leading supporters of needle exchange and harm reduction in our state.
And what's your sense for how many returning customers you have versus new faces showing up for your services?
So we have lots of return customers. So here's a little backstory. So the state changed the laws on how you or changed the policies on really how you can prescribe opiates. Simultaneously, things like OxyContin changed their formula, so you couldn't inject them anymore, and those two things kind of simultaneously caused a lot of young people to turn to injection heroin. So with that, we saw a lot of younger faces and really a younger generation. I think a couple of years we were really seeing people who are 18, 16, 21, and now a lot of those folks are turning into their mid-20s. And so that was a big influx. About every week we see new folks coming in. There's also folks who phase out of their drug use. And I think the way people have to think of drugs is that there are people who use drugs once or twice, right? Then there are people who use drugs once a year. Then there are people who use drugs once a month, once a week, and then you get down to this really small percentage of kind of everyday drug users. And a lot of everyday drug users have some addiction issues, also have some trauma in their lives that if we dealt with some of and did some supporting of their trauma, they may not be an everyday drug user. And there are also people who just love drugs and want to party. So I think we need to think of drugs as this complicated, that doesn't really have simple answers. And addiction doesn't really have simple answers because there's not a cookie cutter system on how to support people in recovery. And if you really want to get down to it, every single American is a drug user because you have, whether it's chai tea, whether it's a drink in the bar, whether it's sugar, these are all drugs. We've deemed some drugs to be illegal and demonized those people. And honestly, we've declared war on those people and made their lives as hard as physically possible and given them as little support as possible. And so I think it's difficult when you really start looking outside the box because this country has declared war on a segment of its population. Like, for example, when Portugal had the drug war, it was really hard because Portuguese didn't like the idea that Portugal declared war on Portuguese. And I think we have a less homogenized population, and we have racism, we have homophobia, we have sexism, we have all these things that try to convince people that they are, it's okay to not like the person next to them, it's okay to be bigoted towards the person next to them. And you know, if you look at the history of the drug war, it really actually comes out of a racist system of you can't make being black illegal, but you can make drugs illegal and target African Americans and low-income folks for drug use. And I'm not even saying it's even that simple. I think it's even more complicated with social issues. And we don't allow public health departments to make it a public health motto and give education and give outreach. And we've severely cut our public health services. And we're not directly funded by public health. I mean, they give us in-kind supplies, and we're very supportive, but it's really listeners like you who give us, who support us and get us money and give us donations to even do the work we do. And we're on a nickel and dime budget. We're in 5 counties in 2 states with 1.5 employees. We have over 200 volunteers who are sometimes, some of those volunteers are working 10, 20 hours a week just to keep everything afloat. And, those are long hours into the nights, and we have such incredible, passionate people who are trying to do what's right in the community with not a lot of infrastructure, not a lot of services. So, yeah.
So, briefly, you had in the article, the great article in The Stranger by Brendan Kiley, you had caused quite a flurry in Austin back in 2011. One of the commenters said there you put the industry back 25 years. Can you touch on that?
Yes, I was on a panel, and there were lots of folks who got angered by some of my comments. One of the comments I made was that heroin saved my life. And, I think some people might say that's really shocking. But drugs did save my life. It did change my life in a positive way. And I think that just the concept of drugs are not evil. They're an inanimate object. And to be perfectly honest, as a young person, my life was chaos. And ingesting drugs made me learn different ideas, made me learn different ways of thinking about things, made me at times numb pain, but in times opened my eyes to different authors and different ways of thinking, and made my kind of anger and my depression wash away and started to create me to become more productive in life and dreaming for the stars and asking questions why, and asking questions why we can't achieve this. And when people told me no, people told me can't, and I'd sort of be like, but I believe we can do these things, and I believe that we can make these great changes. And that wouldn't have happened without my experience with drugs. So I don't know where I would have gone without drugs, but I can tell you that I was a very depressed, very angry young person living in Seattle, and I think there's a good chance I would have killed myself. There's a good chance I would have gone to prison for getting in a physical altercation. But drugs changed that and changed that direction and made me the person I am today. And I love the person I am today. And I love what I've become. And none of that would have been possible without my drug use. And so for me, it was a really positive thing. For another person, it can be a really negative thing. But I think we hear these stories about how, and we're getting actually trillions of dollars in money being told stories of how the drug war is right and how drug users are bad people. And I don't see myself as a bad person. I see myself as a university district resident who loves his neighborhood, who goes out of his way to help his neighborhood, who goes out of his way to do cleanups, to do sit on boards, to do activism, to engage people in their community, to try to build us to be the best neighborhood, the best city, the best state, the best country we can be. And none of that was possible without drugs. So yeah, drugs saved my life, and I am thankful for their existence. And just to be for the record, more than heroin saved my life, I'm a big fan of hallucinogenics too.
All right. We're talking with Shilo Murphy. He's national president at the Urban Survivors Union and co-founder and executive director at the People's Harm Reduction Alliance. And again, quickly, Shilo, where can people connect to your organization?
Well, you can go onto our website, the peoplesharmreductionalliance.org, and there you can see articles on us. We have a YouTube channel. We have a Facebook. We also have a volunteer application to become a volunteer on our website, and I encourage you to fill one of those out. And if you don't have time to volunteer, we could always use $10 and always use donations. You can also come to our comedy show. And there's lots of ways to engage in volunteerism. You don't necessarily have to work the table. You can work in the back room. You can work just helping us with QuickBooks. You can, there's always a ways to engage in community. And if you think, hey, this is not the organization for you to volunteer, there are plenty of amazing organizations in Seattle that encourage you to engage, that do incredible work and could use your support.
All right. Well, with that, we are unfortunately out of time. I want to thank you very much for coming in and spending time with us again this morning.
It's great having